Hello friends and viewers. Thank you all for watching our videos. Lot of likes and subscribers have been increasing. We are very encouraged and thankful to you all for liking our videos and watching it and sparing your valuable time to understand what we want to convey. Like any other video, we want to touch upon a very important and relevant topic today. That is something in a common man's language we call it as stroke. Stroke, the moment we talk about it, the first thing comes to our head or mind is paralysis. Half side of our body is paralyzed. Probably your hand, your legs, and half side it is not functioning well, to various degrees of symptoms we can present with. You may lose the sensation of defecation, micturition, that is urination, lack of speech, you may lose your speech, and you will not be able to comprehend. In the sense, the motor functions of the body, the muscular and joint functions of the body are paralyzed. Why does that happen? Because the nerve functioning in the brain, which is responsible for controlling our muscular and joint actions, have not been working. Why is it not working? There are two reasons usually what happens. We call it as ischemic infarct or hemorrhagic attack. Ischemic means lack of blood supply. So nerves also require nutrition to function normally. So where the nutrition comes from? It's from the blood vessels. So the blood vessels, the blood which supplies the nutrition is blocked. So it is not nourishing the nerves, then it cannot function normally. Automatically the function is reduced or blocked. So when it cannot function, the signals won't come from your brain to the arms and legs and even for the speech, so you cannot speak. So one of the reasons for that blocked blood supply is ischemia, is what we call it as. For what reasons does that happen? Most probably it is the deposits in the blood vessels of various kinds, and that is directly related to our lifestyle, food habits, stresses, and aging factor, genetic predisposition. They all can cause this blockage. Sometimes thrombosis or clots, because of various reasons, the clots can travel from your legs up to the brain many a times and cause this ischemic attack, leading to stroke, or what we call it as cerebrovascular accident in medical language. The other reason for this is hemorrhagic. Hemorrhagic means blood bleeding out of it, blood vessel. Why does that happen? That again is the cause because of hypertension. Most commonest cause of stroke is hypertension. What uncontrolled hypertension leads to so much of pressure in the blood vessel that it ruptures and the blood spills out in your brain and not nourishing the nerves again, leading to paralysis. Again, the same risk factors are there for stroke due to hemorrhagia, because hypertension, smoking, alcohol excess consumption, obesity, lack of activity, stresses of our lives, all these factors can again lead to hemorrhagic kind of stroke or cerebrovascular accident. So how do we deal with all these things? There are two ways. The most relevant is prevention is better than cure. So that is where we come into action. How do you do that? Keep yourself much more active, de-stressed, healthy lifestyle. When I say healthy lifestyle, we have several videos we have put across on our channel. You can view through them, talking about how to maintain good health through natural living, or a routine in the natural living will help us to reduce these risk factors and triggers. But at the same time, that is one aspect we have to do. But at the same time, if you already suffered from a stroke, what should we do? Immediately, a medical need, emergency, medically they have to be treated in an emergency ward by a neurologist and relevant specialists to contain the damage, so that it doesn't cause too much of damage and leading to lot of permanent disability. If it is addressed at a very early stage and immediately, lot of people from stroke recover very well. So once they recover from the initial treatment, that is where we come into action again to do the rehabilitation and get back to their normal life. How do we do that? It's a combination of acupuncture, yoga, and lifestyle changes in terms of diet and counseling. All these aspects come to picture when we address. Specifically speaking, we need a combination of acupuncture and yoga. Most of the times in our experience, we have seen when stroke is want to rehabilitate a stroke patient, the earlier they reach to acupuncture and yoga, the better the chances for them for complete recovery. If imagine that we would say within 3 to 4 months of the stroke, if they come to us, we should be able to help them to a large extent. Several people come to us because they don't know how acupuncture helps after 2 years, 3 years. Then there is a limitation for us to achieve a complete recovery. But how does acupuncture help in that situation? One thing is it works at different levels. At the body level, it will, when we put the needles into specific points or meridian acupuncture points, they help to activate the nerves. Just like an exercise or massage, how it helps in the same lines, but it is an intervention which gets into your body. Those fine needles will help to improve the function of the nerves by increasing the local blood supply. It's something like this. If you have an electrical bulb in your home, that gets switched on only when you switch on the switch. The electrical current passes through the wires. Imagine that the switch is not working, so you will have to replace the switch. Now the conduit which has the electrical impulses passing is cut. So what do? You replace the wire. But in our body, we cannot do that. That replacement or nourishment of those nerves is possible through acupuncture. That's how when we early detection and early stage of treatment for rehabilitation through acupuncture, we can help to recover them completely in terms of getting back their speech, their mobility in terms of their walking, movements of the hands, lower limbs, the legs. All these aspects can be reversed to a large extent. Many people also lead normal life. That is how acupuncture could help. At the same time, yoga and acupuncture also can be preventive to not get another attack, because that would help all the risk factors to be kept under control in terms of stress, obesity, any vices if you have alcohol consumption, and any addictions of smoking. All those things along with counseling should help you to relax yourself, change, modify your lifestyle, motivated towards good lifestyle, lose weight. All these factors would help through that preventive aspect of acupuncture and yoga and naturopathy, so that you will not get into another attack of stroke. Many a times multiple attacks can be fatal. So you can understand how serious the problem is. This is how these alternative therapies can help you in a stroke case. One is preventive aspect. Before you get into it, when you identify the risk factors on a regular basis, when you have medical tests and approach your doctor, you will know where you are standing. So become aware of it, address before it strikes you. If it has already struck you, approach the doctor at the earliest with the right treatment for the acute phase when you have the attack, and for rehabilitation without any medication through acupuncture, yoga and naturopathy, and to also prevent another attack. That's how we can very effectively manage this stroke or cerebrovascular accident in many cases. I hope this information was very helpful. Please pass it on to many people who may need all these aspects for their friends, relatives, someone who is suffering from it, so they can get help to a large extent. Thank you for your time and patience.